Hello, everybody. Thank you again for joining us. In today's workshop, our focus will be to ensure that you understand what the Toolkit for Participatory Evaluation of Practice is, its background, an overview of the contents, the users, and the toolkit, the tools highlighted in the toolkit, how you can use this toolkit in your context of practice, and to reflect a bit on the integration of tools into M&E practice. We will also hear from FFEC members who have utilized these tools, and we will have the opportunity to have some discussion through some breakout rooms, particularly around the use of the toolkit. These discussions will provide us all with the opportunity to share and reflect and discuss our evaluation experiences. Lastly, we will consider next steps for community learning and exchange around evaluation approaches. Next slide, please.
Family for Every Child is a growing alliance of currently 46 local civil society organisation members across 38 countries. At Family, we know that local civil society organisations hold the knowledge and expertise to support vulnerable communities within their own contexts. Across our membership and beyond, local CSOs are providing solutions to improve outcomes for children and families, and are then sharing their knowledge, tools, and models of practice with peer organisations through practice exchange. Practice exchange is at the heart of what we do at Family for Every Child. And for it to be impactful for both CSOs and the children and families supported, we believe it should be rooted in evaluated practice. This new toolkit supports an alternative approach to traditional evaluation dynamics by promoting non-hierarchical processes, drawing on the strength of local solutions, and focusing upon the outcomes and impact of those solutions on communities. Through evaluation, we can build a body of evidence of effective practice in the sector, which will give weight to CSOs' efforts to inform research, advocacy, and influence policy and practice. And we know that when evaluation processes are conducted in participatory ways, there can be rich learning and exchange both between peer practitioners and the communities they support. This toolkit was developed through a highly participatory process. 21 Family for Every Child members contributed through a globally diverse reference group, and 5 of those members went on to pilot the toolkit in their communities. The toolkit presents clear guidance around evaluation goals and processes, as well as accessible participatory tools for prioritization, planning, and data collection, which can be used to build a clear picture of impact. So I'll hand over to Akrita now to share more detail about the toolkit itself. Akrita and Samin.
So we are now going to understand what is the toolkit for participatory evaluation of practice. The toolkit aims to support you by offering practical tools for qualitative and quantitative data collection and its analysis. And the toolkit also strives to be adaptable and accessible to a variety of organizations so that it provides guidance on measuring your project outcomes and objectives. And the major and the key intended outcome is to enable the translation of M&E data into effective decision making. Now let us understand what are the key contents of the toolkit. So as I said, the toolkit will help you understand what is participatory monitoring, evaluation, and learning. And there are clear guidance on conducting PMEL activities in your context and thematic areas. You might be working in various thematic areas. So this toolkit will provide you clear guidance on conducting the PMEL activities in that particular areas. And there are total 22 tools included in the toolkit. It is divided into 3 areas: prioritization, planning, and data collection, which we will talk later in the slides. And it is also, the toolkit also comes up with instructions and practical templates for you to use. And the interesting thing in the toolkit is that there are case studies of local civil society organizations who have implemented PMEL activities to provide practical examples of use. Now let us understand how to use this toolkit. So as I told earlier, the toolkit comprises comprehensive guidance on PMEL, and there are 22 PMEL tools. Here are some suggestions for using the toolkit, which includes you need to identify the project phase where the tools can be integrated to enhance your project effectiveness. And to maximize the tool for your organization, try sharing feedback from those using it, identifying who will be responsible for compiling this feedback, and capturing any adaptations that has been made, and understanding how obstacles to its use were overcome within your project work. One of the important thing is you need to consider your engagement with children, youth, families, or any other stakeholders as you incorporate this tool. And make sure to reflect on what is your nature, what is the nature of this engagement? How might this tool strengthen the quality of your engagement? Because there can be a risk that children and youth or young people involved is tokenistic or just be a ticker box for you. But this approach is not ethical, and it is considered as unethical, but also means that insights from these key stakeholders are missed. And last, one thing to consider is, exchanging your learning with other civil society organizations, researchers, and other organizations who can benefit from these experiences.
So who is the toolkit for? The toolkit is for every civil society organization who wants to evaluate their practices using accessible, adaptable, and user-friendly tools. Next slide, please. What are the tools? The toolkit incorporates 3 levels, that is prioritization, planning, and data collection. In addition, there are resources such as templates that will guide the PMEL process. Next slide, please. So the tools for prioritization help to measure and determine which activity, problems, intervention, etc. you need to prioritize to achieve higher outcomes. For these, there are 3 tools: the community mapping activity, the grid method, and the Moscow prioritization method. You may want to review each tool to determine alignment with project outcomes and priority areas. This will add value by improving project structure and capacities, as well as clarify project goals. These tools are participatory, as their use involves stakeholders and community members by understanding their issues or perspectives. For example, when using the problem prioritization community mapping activity, you have to understand the community issues or problems and prioritize those problems to decide your intervention or activity.
Now we have tools for planning. So the tools for planning help identify and define your project scope, objectives, outcomes, impacts, and risk. So these tools are intended to guide you in planning, analysis, and decision-making process. These tools were developed independently for diverse purposes. However, they were assembled together in order to achieve operational efficiencies. These tools are participatory in nature, and you need to bring together the community and understand their problem and issue themes to decide on your activity. For example, if we choose the problem and objective tree tool, so in order to use this, you need to first define your objectives. So in order to derive your objectives, you need to first understand your problem statements. These problem statements can only be understood by involving and understanding perspectives from your stakeholders. Then we have tools for data collection. As you can see, data collection is through both primary and secondary sources. And these tools improve the integrity of your research. They are mostly cost effective and most importantly, reduce the likelihood of errors. Additionally, these tools add value to research, resulting in effective and accurate project outcomes. These tools involve all the stakeholders to collect relevant data. In this toolkit, we also have additional resources that will support the M&E process, including, as you can see, the monitoring plan, monitoring strategy. We have annual monitoring report and M&E data analysis template. All of these additional resources will help you support in your PMEL activity.
I'm William Gali from Family for Every Child, focal point for monitoring, evaluation, and learning. I just have a couple of slides to talk about the context of using these tools within our monitoring, evaluation, and learning processes. Although Family for Every Child uses outcome harvesting as its main monitoring, evaluation, and learning tool, we have recently introduced results frame to document evidence of the outcomes and also to guide and incorporate other tools relevant to various projects, joint actions, advocacy, campaigns, etc. And we hope we can integrate some of these tools very cleverly and creatively, and not consider that these tools are something extra. To that end, we become familiar with these tools. Each time we prepare probably the new projects, the concept notes, the frameworks, and then integrate them also in our training. I use them for learning and reflection during quarterly, annual, and donor reports. Next slide, please. I think we have really a great opportunity to use many of these participatory tools, particularly in engaging various stakeholders in all participatory processes, including the children, families, communities, government actors, etc. Especially our model of working is working or engaging stakeholders and prioritizing that. And lastly, the toolkit also is a powerful and robust guide to those looking to evidence the strength of their practice and build a holistic picture of impact. And we have noticed that when our members piloted these tools and in the reports, we can clearly see that this is a great opportunity. Thank you.
Thanks, William. Next slide, please. So after our members share their experiences of piloting the toolkit, we will be creating some breakout rooms. And we'd just like to ask that if anyone would like to needs to be in the Spanish breakout room, please could you do a thumbs up or put your name into the chat box so that we can make sure that we assign you all to the correct rooms. So just this, if you need to be in a Spanish room, please let us know either by a thumbs up or typing in the chat box. Thank you. So as part of the development of the toolkit, 5 Family for Every Child members spent several weeks last autumn piloting tools in their organisations and communities and providing feedback to inform the final version. 2 of those organisations will now share some of their experiences with evaluation approaches and this toolkit. So I'll first hand over to Pierre Koulibaly from Enda Jeunesse Action in Senegal. So over to you, Pierre.
thank you very much for giving me the floor. And I would like to share some results according to our experience in the use of the toolkit. We have experienced a lot of evaluation in the past. So we were subject to external evaluation. We also carried out some self-assessment activities. But thanks to the toolkit, it's possible to use the results of the evaluation in our communities. So as far as the tools that we were using in the past are concerned, we weren't able to share any information concerning their design and their method. But as members of the organization, we are there to use the tools to understand their content. And as far as the evaluation is concerned, we've also carried out cross-evaluation activities, especially with the communities. So basically, we can have different groups of people or different communities, and the representatives of the communities help us design the tools that are later on tested in synergy. So we test the tools together, and then we work in small groups to understand how to better manage the tools within the communities. So this allows us to make sure that the group representatives can actually work among them. So this is the part of the cross activity. We share our results. And as far as cross evaluation is concerned, this is also a participatory process. So we have the monitoring, evaluation, and learning part. And in its framework, we've been able to understand that we can guarantee ownership of the process. So community members feel part of the process. They feel like stakeholders and real players. And this is a key part for us. So they don't feel like objects, they are active players, stakeholders, and this ownership is key. In addition to that, we've also noticed that recommendations are fully accepted. Our decisions, our recommendations that are based on the process are well accepted, and all the people who are involved feel like part of that decision. So they recognize and accept the decision taken and the recommendations given. So this allows them to be fully engaged into the planning activities. So these are the key elements that we have identified in the framework of our process, and they are very important. They are actually the result of our participatory evaluation process. So to share our experience, we've used the toolkit, and during the pilot stage, we've been able to collect some important results. First of all, we have some guarantees for facilitators. So facilitators feel safe because they have a tool, a supporting tool to be used. So facilitators have the means to animate and to manage the whole process. So this is a way to strengthen their participation, but also their trust and confidence. So they think they can make it, they can really make a difference and offer a contribution thanks to the availability of such tools. Then another key element is participation, involvement of stakeholders. So as I said, we've tested during the pilot phase this tool, and we've involved some youngers. The objective of the project was to find financing to fund some activities of the associations. And thanks to the toolkit, we were able to guarantee the involvement and participation of all of the stakeholders in terms of analyses and decision-making process. So each of the stakeholders was given the opportunity to participate in the decision-making process and to have a say. So we have a real participation of the people involved. All of the participants were actually very much focused on the objective, because the objective is very clear to everyone, and every time we move on in the process, we review it in order to give priority to the objectives. We also identified specific priorities. So today, for example, one of the priority of the group is to find resources. And the organization has decided to set up a store to sell some products. And among priorities, we have identified the objective. So some actions have been prioritized because they are closer to the objective of our project. So the toolkit has really given us the chance to set the priorities. So today we have been able to set up this store where young girls can work. So basically the toolkit allowed us to set the priority of the activity according to the project. And with that, I think that such an approach has been beneficial to all of us. So the toolkit was key in offering us more confidence, more visibility about the process, and greater focus on the objectives. So our experience has been really enriching for all of us. And we hope we can continue using the toolkit, as I mentioned, because I think it's very important for our professional practice. Thank you.
Thank you so much, Pierre. And I'd now like to introduce Rushani and Shampa from Foundation for Innovative Social Development in Sri Lanka to share some of their experiences. Shampa, how's your connectivity?
It's okay for the moment.
Okay.
So I'll take it forward. Right. Thank you for the opportunity. And I will start with some experience that we have on evaluation processes. I have been exposed to conventional as well as participatory evaluations. I would like to highlight one of the examples of participatory evaluations, apart from what we have tested out now, which I think will be also useful for our learning. It is called a utilization focused evaluation process, where we were able to kind of, the process is with users and the users. So as users, it was us who were looking at our own work, and we were able to kind of identify the what users do we have from this particular utilization focused evaluation. So in this type of evaluation, there were key evaluation questions that we could formulate on which area or which segment of our program that we need to evaluate. So it was kind of a very non-threatening process, because as implementers, we had the opportunity to look at what we wanted, what should I get evaluated on. And at the same time, we could, go to the communities or the beneficiaries and talk to them very freely using particular tools where it was giving both parties a very good direction for our future decisions. This particular utilization focused approach that I am talking was exercised to understand, to make sense of the theory of change that we had in hand. And the other was to explore in details of our integration, because at that time, FISD was having 3 thematic areas. One was child protection, one was gender-based violence, and the other was alcohol prevention. So these 3 thematic areas were tested out in the field in isolation in some working locations, while integrating some components from the other 2 thematic areas. For instance, if I say child protection was implemented in a village where we would bring in gender-based violence components as well as alcohol prevention components into our program design. So the integration was to be looked upon. Then there was also capacity building components which we wanted to review. And then we wanted information for future direction. So we were able to formulate our own questions and own sub-questions and look at how good we have been in implementing our project. So this was one good example I could bring out of participatory evaluations and some tools that we used at that time. The data collection instruments we used were qualitative. They included focus groups and semi-structured interviews, as well as PRA tools. So especially this was very useful for us when we worked with children and the youth. For us, the particular evaluation process where participation of project implementers and the beneficiaries was high and was an, as I mentioned, extremely a non-threatening process compared to a conventional evaluation process. Next slide, please. Yeah, why participatory processes are so important for monitoring and evaluation? I would say local people are active participants in the M&E process. So through this process itself, they learn and become empowered. The other thing I could say is it provides a space for those who are often not heard to be heard. Rather than limiting their answers to a structured questionnaire, here in a participatory process, they are able to express more descriptively. It is their ground, their realities, so they can become more confident and articulate better. It is also a dialogue between all stakeholders, hence becoming a rich source of information. It also helps people to reflect on their actions. Once again, the evaluation opens space for them to look back and understand the process, how they have come thus far to achieve such a situation at the end of the project. It also makes them understand what works for them or what does not work for them in their context, and reach out to their own conclusions and corrective actions for future action. Next slide, please. What are the benefits of working alongside peers? I think mostly it is very much supporting us to build capacity, because it paves a way for building the capacity of the stakeholders. We also know that when we are in a peer learning, we do not, do the same mistakes that our peers have done. We have time to look at our processes, our context, and take the corrective measures. We also get the participants, I think, empowers themselves by looking at our peers. The other positive factor is that these tools are tested. Hence, it is time saving for us. We don't need to, reinvent the wheel. We know that this has been successful in a similar context. And then we can directly use it in our context. Learn from others, positive and negative, and improve accuracy. I mentioned this earlier. This is, in a way, an educational practice through which one or more individuals, such as co-workers from an organization or field, teach and learn from each other. It lessens the power dynamics that come from organizational hierarchy, or the bosses or leaders who would usually be in this evaluation process, looking down at the people, whether they have done their part right. This is more a participatory evaluation where your peers are, with you, and it makes you comfortable. So I think we get a more equal footing as we all share the lessons that we have learned and seek ways to improve their own practices. The toolkit presented by family for every child comes with clear guidelines, I would say. And it's an opportunity for anyone who wants to engage in participatory evaluation, because it gives you a whole lot of tools which could be practiced quite easily. Although FISD has have limited exposure to the tools, we have selected only a few tools. But looking at the number of tools that are presented to us, this is very useful even to a beginner, because it gives you clear guidance. My colleague who was directly involved in testing out the tool will continue from here. So thank you very much. Rushani, it's over to you.
Thank you, Champa. Actually, I will give a nutshell of our experience, because due to time concentration, actually, I would say that since 2019, through the 5 years of program cycle, the FISD Child Rights Protection and Promotion Program has worked to end violence against children. Through that program, FISD established community-level platforms for children to empower their participation. FISD incorporated the M&E Toolkit pilot program to empower 400 children, understand the problem, identify the solution, prioritizing the action, and develop community-level action plan to prevent corporal punishment and domestic violence against children under the banner of happy and safe families and communities. This pilot program helped 1,000 children become mobilized to carry out campaigns to end corporal punishment. along with that, 400 child club leaders, with the consultation of adult, developed 16 community level actions plans for 2023 to collectively engage to preventing violence against children. These tools aided in increased children's active participation and teaching them to how to collaborate to achieve common goals. Thank you.
Thank you so much, Rishani and Shampa. Yeah, some of the words that you used there really stood out. Non-threatening, empowering, reflection, dialogue. I think they all are really good representation of what we mean when we talk about participatory evaluation, so thank you. It's been really interesting to hear how the tools have been effectively used within your communities with children and families. And even since the end of the pilot, I know both of your organisations, FISD and ENDA, have used some of the tools within your working cycles. So that's really, really great. It's important to note that, as well as one of the challenges noted by William earlier around staff time to learn and use the tools, issues around technology were also raised during the pilot process. That is, struggles using data collection tools when in the field due to connectivity issues. So one takeaway there is the need for tools to be available offline. Over to you, Sajida.
Thank you so much. And, thank you so much for sharing, Pierre, Roshani, Champa. It was really wonderful to hear, how the tools are not only useful for Merle, but really also really useful for capacity development and for learning and for project implementation. And I really appreciated what you said about the ability to monitor and evaluate those elements of the project that are truly going to be valuable for also future planning. So that's exactly how we'd love to see the tools continue to be used. So we're going to now divide into 3 groups for about 20 minutes of discussion. And what we would like to do in this time is to really share reflections and experiences around evaluation of practice. And we've just outlined 3 discussion prompts that we hope that you'll be able to dive into in your respective groups. So first, to just share some experiences around evaluation in general. Second, to share some thoughts on the importance of participatory approaches in evaluation processes. And then third, to reflect on the toolkit itself and how it can be integrated into your processes. So we're going to divide you into 3 groups. We will give you each group will have 20 minutes, like we said, and then we'll come back together into the main room to share the key outcomes of your discussions. Excuse me, as well as reflect on other questions that may arise. Welcome back, everyone. I hope that you had some engaging discussions and that you enjoyed your time in the smaller groups. So we're now going to ask the note takers to share with us discussions, reflections, or key takeaways. And we ask that you speak for about 3 minutes each. If you go a little over, that's okay. But we just want to make sure we also finish on time. For some people, I heard in one of the groups that, it's ridiculously early in the morning for them. So we thank them for joining us, but we also appreciate that they might want to catch a nap before the day actually gets started. So let's start with the group A, which was the French group, or the group that had the French translators. So this was a group that was facilitated by Georgina. And Georgina, who was your note taker?
First, Sajida, can I check that everyone's gone back into their language channel? Because I think that we have to do that again.
Georgina, we can't hear you.
Can you hear me now?
Yes, yes.
Yeah, so I just wanted to remind everyone to do what I had not done. Go back into your language channel. So we had a very small focused group involving ENDA, Jeunesse Action. So we had Pierre and Ngunda. Pierre or Ngunda, would you like to just comment on your thoughts on the question, how do we integrate this into the process? And then I can follow up a bit with some of the other points we discussed.
Well, I would like to leave the floor to Ngunda for the presentation.
Mukunda, yeah, he's starting.
I think we can hear you, Ngunda. You may talk, please. In our group, we try to discuss the experience of the evaluation and the toolkit. Also, we discuss participation and also the reflection on how to integrate this toolkit within our organization. The reflection was more on the third question. So, how to integrate this toolkit in our processes. Considering the work we do is an online work in network, it is important to digitalize such tools, and using such toolkit may allow us to save time and also be more productive. Another reflection that was done is thinking how to adapt depending on our communities, this toolkit. We have seen in the experience that people are not always alphabetized. So when you work with a community where the majority of people is not alphabetized, is illiterate, well, this may be a problem because the majority of our tasks, of our action is written. So it is important to take that into consideration so that to be really integrated within the communities. Another reflection. Is it possible to have this toolkit online? The answer is, yes, it's possible, and it is quite useful because the majority of the work we do is in network, not only national network, but also local networks. So the ENDA approach today, but also other stakeholders in Senegal, is working in synergy, in network. So having this toolkit online may allow us to save time and also allow to share experiences and tools. I'm not sure if I have lost some details, but I will leave the floor to my colleague if you wish to complete what I've just said. Thank you.
Thank you so much.
I think,
Anybody
Gunda, you have said the essential. Thank you.
Thank you. Anybody else have anything to add? Georgina, did you want to add anything?
No, I think actually Nugunda's covered that, the tech side of things and the adaptation side of things. And I will just flag that I think that there are some elements within the toolkit where we've talked about alternatives to written tools. I think Akrita and Sajida, that's right. We've presented pictorial alternatives, for example, but I think it's a really important point, the need for adaptation in cases of illiteracy.
Absolutely. And also there was a point made in another group about the importance of providing, inclusive approach. So providing for those who are disabled or have hearing. So I think that's a valid point as well, of course, as language. So thank you very much, Group A, for your participation and for sharing your reflective thoughts. We'll now go to Group B, which was facilitated by Akrita. Akrita, who was your note take?
Yeah, so from our group, Audria Chaudhary was the note taker, and she would share with us the highlights of our discussion.
Yeah, so hopefully everyone can hear me. So from our group, we focused on the second and third questions. So in terms of the importance of participatory evaluation, William brought up a good point that participatory evaluation doesn't start at at the end. It isn't just a focus group discussion with beneficiaries to get their feedback, but it really starts at the beginning, at the concept note stage of any program, so that participants are really helping to develop the questions to be addressed. They're putting together the monitoring and evaluation plan, and that just makes the whole process much more powerful. It also brings out a lot of creativity for solutions in a way that's comfortable for participants. Hassani also gave a really great example of when participatory evaluation ended up creating some surprising insights for their staff. So for example, they were using an evaluation method that was considered a global best practice. That's why they were using it. But when they actually talked to the children and involved them in discussing the method, it turns out that the children weren't really comfortable using that method. So that was something that was surprising to Hassani and his team, and it just opened their eyes to how ethical and effective methods really are on the ground, even if they're considered best methods. Nishit also gave a really great example of how to be accommodating or adapting processes to the need. So for example, they had a program about how to empower children about knowing about safe touch and sexual abuse through the use of animal stories in a way that was non-threatening, in a way that didn't alarm teachers or parents or anyone about a very sensitive topic. And they wanted to know how to evaluate such a sensitive program or such a subtle program. And so they were able to figure out a way that had to do with having the children sort out cards into envelopes regarding safe touch 6 months after the intervention to kind of test or see if the information had retained. So those are really great examples of participatory evaluation. And then going on to the question about experience using the toolkit and how to integrate it into an organization's processes. One participant had shared that it was actually initially a challenge to incorporate the new tools. It's new processes, it's different from what they use day to day, but ultimately they appreciated the opportunity. They really liked the tools that they got to use, and now those have become a part of their toolkit. Champa, who had presented earlier, and Dr. Abla in Dubai, who have also used the tools, they mentioned that overall they had really positive experiences, used words like easy to incorporate, simple guidelines on how to use. Again, the word non-threatening and comfort came out a lot in our discussions in terms of how comfortable it was to get participants to be involved and engage in the discussion. So non-threatening, comfort, simple. And it also gave the staff members confidence in what they were doing, because they felt like, okay, we're using practices that are used globally, that have been tested and approved. And so we feel more confident about our results. And because they are more participatory in nature, then the information is richer as well.
Thank you so much, Audrey. That was really comprehensive and very, very clear. Much appreciated. Anybody from Group B wanted to add anything? Okay, thank you so much. And now we'll go to Group C, the group that was in the main room, and they were facilitated by Samin. Samin, who was the note taker / presenter?
The note taker in our group was Angel. So can you please present?
Well, thank you very much. Well, in the group, we discussed about how we implemented these tools and how they helped us to make our target population participate as well. Some of the observations were that they allow them to identify the cause and effect from their perspective, which could be children, teenagers, or in some cases, also adults. And this also helps to create a balance in the power status, meaning that when our target population is able to give their opinion about the services, about their own processes, then they're not passive subjects, but rather participatory objects of their own conflicts. And this was something that they saw in all the different participants that observed this. We also think that this toolkit has helped us to improve our practices and to know what are the things that are adding to the intervention and what things we need to improve ourselves as organizations. Another thing is that it helped us to identify the evaluation needs to the services that we want to implement and how we can improve this interaction towards the target population, because we may have some modules or some ways of carrying out our work, but if our target population does not feel comfortable with that, or it doesn't help them to reach a solution or an effective solution, then the objectives that we want to reach maybe things that are not so clear. So, well, I believe that we all agreed that these tools have been useful, that we can continue to implement them, but also we need to implement them according to the population that we are servicing. We also agreed that we have to take into account other type of strategies in order for the evaluation to be more sensitive towards the conditions of our target population, meaning that if they have limitation in terms of reading and writing, in terms of understanding the evaluation tools, then we need to create strategies to help them understand better these tools. So that in general was the discussion that we had. Thank you.
Thank you so much. That was also very insightful, and you're absolutely right. Context is always key. You know, understanding your population, understanding the programmatic outcomes and the agenda is so critical in order to contextualize and tweak the tools so that they are really aligned to the needs of the population as well as the needs of the organization. So thank you all so much for participating and for really sharing your perspectives. Are there any questions or any other key factors that we think that we should be considering for monitoring and evaluation as we think about M&E within our respective contexts? Anything that you'd like to highlight for this group? Are there any questions regarding the toolkit that anybody would like us to respond to?
Yeah, I had a question. I haven't had a chance to look at it in depth yet, but is it available just like for public and free use, or is there any kind of like fee or requirement that goes into using it?
Georgina, could you answer that one?
Yeah, it's absolutely available for public free use. So I shared the link earlier on in the chat box. Hopefully you've got that. So yeah, we'd be delighted if you go in there, take a good read, share it with your communities and networks. It's available for wide use.
And it's also been translated already into French and Spanish, so it's already available in multiple languages.
Okay, wonderful. Thank you.
Any other questions? All right, thank you so much. I'll now turn it over back to Georgina. Georgina?
Thanks, Sajida. Akrita, could you move to the next slide, please? Yeah, so in terms of next steps, well, firstly, hopefully you've all seen the toolkit itself now on our Changemakers for Children platform. But we see this toolkit, we hope that it will kickstart a learning process within our Changemakers for Children community about participatory evaluation approaches, so that we can collectively continue expanding and developing our bank of tools and experience in this area. And we've been envisaging a peer-to-peer support process. So as organizations conduct evaluations, they support and engage with their peers through that. We'll update you further about developments soon. And I think most of you will have registered for this workshop via the Changemakers platform. So we'll likely know that this is our community platform for child rights practitioners, Changemakers for Children. It's a space for local practitioners to come together and connect, collaborate and communicate, to learn from each other about what's working on the ground, participate in discussions, solve problems, participate in advocacy initiatives, and engage with and influence the wider sector. So if you haven't already, we really welcome you all to become active participants in this digital platform and join the discussion. I think, Akrita, you were going to share the link to that in the chat box, please. Thank you. So we've come to the end of this workshop, but before we close, we will just launch a brief closing poll and would invite you to complete that, please. I'd really like to thank Altamont Group for all of the hard work creating this toolkit over the last 9 or 10 months, and the 21 Family for Every Child members who provided substantial, valuable input into its development. And many thanks also to all of you for attending today, contributing so actively through the breakout groups. And we hope to see you all at another one of our events soon. So thank you and goodbye.
Thank you so much, everyone.